Well, welcome back. You are watching Channel 1 News Hour. Of course, we are now talking about your health segment, and we are focusing on blood donation, blood transfusion, and particularly we are trying to understand what are some of the issues that face us as a country when it comes to donation of blood, because we are facing an acute shortage of blood. Why are people not donating? And these are some of the issues that we will be focusing on. Of course, this coming at a time when we have seen a recent strike at the Kenyatta National Hospital, where operations were affected, and one critical area that was obviously affected was the issue about blood services, and that is what we will be looking at. What exactly can we be able to do, and is it possible for each and every one of us to voluntarily donate blood and build our blood bank? And for more insight into this, we are now joined by Dr. Kibet Shikuku, who is a hematologist at the Kenyatta National Hospital. He's also a lecturer at the University of Nairobi, and he sits at the Kenyatta National Hospital Transfusion Committee. We also have with us in studio Joseph Kamotho, who is a blood donor recruiter at the Kenya National Blood Transfusion Service. Thank you, gentlemen, for coming to our studios.
Thank you.
We'll be talking about what a donor recruiter does, but before that, why are we always talking about, acute blood shortages in the country? I'll start with you, Joseph.
Thank you so much for that question. Thank you for inviting us to the studio. It's true that we talk about acute blood shortage, and this emanates from the fact that Kenyans have not come out the way we would want them to come out to donate blood. So part of the reasons why majority of Kenyans don't donate blood is phobia. It's just fear of the unknown.
Cultural issues, perhaps?
Okay, in some areas, cultural issues are there. There are some people who believe that they don't have blood, or they feel that maybe if you donate blood, where are you taking my blood to? They think that you may take the blood and go and do something with it. So it's the phobia and the fears are not founded on any scientific truths. So what we are saying is that we need to appreciate the importance of donating blood, and the fact that blood can only be obtained from a living human being. Yeah. Modern science has never helped us to manufacture blood in factories. So we have to get it from people, and the entry point of getting to a person is to communicate to them, persuade them, make them understand, so that they can do the blood donation.
Okay.
Yes.
Dr. do you think it's really sustainable to always hope that people are going to donate blood voluntarily?
Yeah. So first of all, let me start by saying that blood is both a weapon and it is also a drug. And it is almost an impossible thing to purchase. You cannot be able to pay for someone for, donating their blood for use. And that is the main reason why we advocate for voluntary donations of blood. If someone told you today that you need blood, for example, and you are asked, so who should donate for you? Chances are that you potentially may start telling us, I don't want blood from, let's say, a Turkana, or get me blood from this particular person. You
encounter those kind of issues.
So for us to be able to avoid such kind of discussion, we encourage that blood is given for free. Okay, and so if you look at the current challenges that we have as a country, just getting back to your question on the quantities of blood that we have as a country, the bigger challenge that we have is that our donations are actually at less than 30% as a country. And Kenyans are very good at donating when there is some form of disaster or when there is a huge event that has happened as a country. All our blood banks get flooded. Then we somehow disappear. I don't know where we fizzle out to do, where we disappear to, only to re-emerge later in case we have some form of disaster. Our call is to ensure that we try to have some level of sustainability. Let Kenyans come out, let Kenyans donate for free. We cannot potentially be able to manage what we call remunerable donors. There are donors who can actually be paid, but those kind of donors cannot be sustained in our setup.
Do we have that setup in Kenya?
So first of all, we don't have remunerable donors in this country. And there are
But
very
perhaps, do you think that is something we need to explore, given that people are not volunteering?
So there are more challenges actually in dealing with remunerable donors than dealing with voluntary donors.
How so?
If you want to be a remunerable donor, the requirements are more stringent. You don't live your life. The requirements are stringent in the sense that a lot of drug companies, for example, have remunerable donors. And these are the kind of donors that would give certain blood products or certain components of blood that would be used by those companies. And so there are certain aspects that may be required of you as a donor, if you are that kind of donor. So we are not in that state yet. And I'll also tell you that when blood is given for free, if you look at the charges that we actually pass on to the patient in terms of costs, it's relatively lower compared to if blood was to be sold. For example, at Kenyatta National Hospital, we charge a unit of blood for 2,500 Kenya shillings. But if you look at what goes into processing the blood itself, it is between 15 and 20,000. So the extra costs are actually lumped up by the government. A reason why dealing with the remunerable donors is almost impossible. It's not sustainable. So I think key is for us to figure out how we can encourage people to donate voluntarily so that then we can deal with the shortage.
The sustainability, in your perspective.
I can comment on that issue of paid for donors and non-remunerated donors. A donor who is not paid is most likely going to give you a unit of blood that is safe. A donor who is paid is most likely going to give you a unit of blood that you're going to discard.
Why don't you pay them after you are sure you can use their blood?
Okay, actually paying blood donors is against the Kenya National Blood Transfusion Policy. It's actually against the laws of Kenya as we speak. Maybe if they review those laws later.
Do you think perhaps we need to think about reviewing it based on the fact that you're saying 30% of Kenyans are donating blood? So how do you ensure you get this blood?
From where I sit, it will not be reasonable to get paid for donors. Yes. Let us try to, the best practice globally is having non-remunerated blood donors.
But practically, is it sustainable? People are not donating blood. People know they need to donate blood, but they're not donating blood. Yes. What would be more sustainable?
So what we may need to do is to look for better strategies of bringing people on board to donate blood. Yeah, we do more resources, we get more partnerships. Then we like, for instance, the blood program, we make it funded better than it is today. We capacity build it. Let us have staff. Let's have the other logistical support like vehicles, the reagents that we need, better blood testing and grouping equipment and all that.
All right, Dr. Let's talk about a different aspect of donation of blood, the one which perhaps we call replacement donors, the ones where you have a family member who is sick and you're told, bring your family to donate blood for you so that we can give it to you. I mean, don't you think that is putting a lot of strain on a family? Just telling them, your member is sick, you need to come and donate your blood, and perhaps they know their blood isn't good enough, but because of the pressure, they just come for the sake of it. Is that a sustainable way for us to rely on?
Yeah, thank you for that question. So replacement donors has just been an alternative way of us dealing with a problem that requires a little bit more bigger in terms of ensuring that more Kenyans actually come out to donate blood. If the National Blood Transfusion Service was functioning optimally, we wouldn't be struggling with replacement donors. What we would like to do is to have regular donors. So a regular donor is not a donor that I would say is subjected under pressure to give blood. Because generally, people should be donating blood after every 3 months. So what the national program should attempt to do is to mobilize more donors. And because this is their responsibility really to try and get us blood as a country. And if you look at the collections at 30%, we are then forced as treatment facilities to request relatives to literally donate. Of course, that is not the best approach. It may just be one way of resolving a problem that is distressing all of us. And I think key is for us to figure out how to create a sustainable program. For example, there are certain ways we could motivate the donors.
Yes.
We are supposed to be having donor clubs where people can discuss why donations are good, why donations would save lives. Because again, as I've said, it is almost impossible to sell blood. You cannot sell blood to anybody. It's almost impossible. You cannot.
It is criminal, like you say.
Exactly.
Yeah.
So the best we can actually do is to encourage people to donate blood and understand why they are actually donating. What does blood do when you donate? And I'll tell you that practically speaking, in a medical setup, we don't need the entire unit. We just need a portion of it. We need what we call a component. So when an individual donates blood, we process it and we get components out of it. Okay? So that is one way of us addressing the current challenge. The other thing that possibly we need to do so that then we end up with sustainability is to utilize newer technologies. Lately, there are better technologies of acquiring blood from a donor. Instead of me bleeding you, for example, and getting blood out of you and getting everything out of you, I can actually use an equipment, reprogram that equipment so that then what I get out of you is just relevant for use depending on what the intention is. If I'm interested in a component in you, I don't have to necessarily subject you to removal of everything, you know, that has to do with the blood. I can just reprogram the equipment, and we call that apheresis, and this is being done in other countries where people are now being subjected to just removal of specific aspects of blood that would be relevant for the patient.
So we need to improve our technology.
So we need to encourage better utility of newer technologies for us to address the challenges.
Okay, let's talk about, the centralized blood service under the National Blood Transfusion Service. It is, that is the only organization that is mandated to do collection of blood. We now have 47 county governments.
Yes, true.
Perhaps, do you think it is time to devolve this service?
Let me say that the mandate of KNBTS is to collect, process, test, and distribute blood to all transfusing hospitals in Kenya. As we speak, we are serving 500 hospitals in Kenya with blood. After the 2010 constitution came into place, the country was actually, the counties were devolved. We are under the devolved system of government, and we are working. I mean, most of the beneficiaries of this program are in the counties. As we speak again, we are represented in 23 counties. We have blood banks or blood transfusion satellites in 23 counties. Actually, the structure of KNBTS is that we have 6 centers. One is located in Nairobi, another one in Mombasa, another in Kisumu, Embu, Eldoret, and Nakuru. Those centers have the capacity to collect blood, process, test, and distribute to facilities. Under them, we have satellites. We have 18 of them. Those ones can only collect and send samples to the centers for testing, then distribute to the hospitals once they are cleared for TTI. Yes, so basically what you're saying is that we are moving, we are expanding our tentacles, and eventually we'll get to every corner of this country.
But based on what you're saying, you've been there for a while now.
Yes.
We are still talking about 30% of Kenyans distributing blood. Don't you think it's about time perhaps to do things differently?
Yes.
Why are you not able to increase the numbers?
You see, what we are doing, we have stepped up campaigns. And we, for instance, we engage with partners. Recently, we were engaging with a corporate. We did a nationwide campaign that got quite a substantial amount of blood. Recently, we supported our Mombasa team. They went out. They came up with quite a number of units. And we have lined up another partnerships with some corporates. But as we speak, 80% of the blood that we are getting today is coming from schools. Actually, that's our biggest stakeholder.
That's your biggest stakeholder?
Yes.
All right, Dr. Based on what he's saying, Kenyatta National Hospital, of course, is the largest referral hospital in the country. That means, you get to deal with a lot of blood. What percentage do you actually get from the National Blood Transfusion Service? Do you really think it is effective as it is?
Again, just looking at our collections as a hospital, and again, relying on the national program, has not really taken us to where we would like to be. Our current consumptions as a hospital lies at about 100 units of blood per day. 40% of those would actually take care of our emergencies. Another 40% would support our cancer, program at the hospital. Then you are left with that 20% to manage the other conditions. As we are discussing right now, we get between 10 and 15% from the national program because they're already deficient.
Yes.
So that basically means the entire process is not sustainable. I think, as my colleague has mentioned, we need to figure out how we can partner. But I think the partnership should allow us to figure out which other better mechanisms and avenues could be adopted for us to then manage the program more efficiently. If you are to borrow from other programs nationally, the National Blood Transfusion Service should be playing a quality assurance role so that the other facilities are allowed to look for blood. They can engage their communities a lot more, much more aggressively. Like the counties, for example, understand the needs at the ground. Mothers are dying because of lack of blood.
Yes.
I mean, we just can't keep losing life because of some type of legislation that doesn't allow us to aggressively engage everyone. So I think it is high time we should have a bigger discussion on how the counties should be engaged to actively look for blood, while the national program is supporting safety issues.
So it's more like playing the prefect, the overall role of ensuring the blood is safe.
So that then there is quality.
Yes.
Because again, the bigger challenge usually with the blood is that you want to make sure the blood that a patient gets is safe.
It's safe, yes.
So as a facility, as a hospital, really, our consumptions are much higher than what we get. And we do not think the mechanisms that we are using currently are sustainable. Will not actually manage to meet our demands. And I think it is high time that we all pull together to try and get as much blood as we can.
Our time is up, but just very quickly, I mean, in your opinion, what do you really think we should do to be able to improve the supply and safety from voluntary donors?
So I think for me as a person, and again being the chair of our hospital transfusion committee, really is, as of now, is to call upon Kenyans to try and donate as much blood as they can. And join, donor clubs so that then we can try to regularize our donations. The second thing is that if you look at what other countries are adopting lately, use of technology,
yes,
so that we are not wasting a donor. We can actually be able to redraw or get blood from a donor, depending on the component of interest, even within 2 weeks. So imagine you donate today, in the next 2 weeks you are still eligible to donate.
Because we have not taken most of it out.
Exactly.
Okay.
So even for the people that are actually donating, we can still be able to get blood from them as many times as possible. Secondly, using newer technology, where you would have pulled units from, let's say, 6 donors using the conventional method, you just need 1 donor using the latest technology to get the same amount of blood.
So that
Thirdly,
we can build the bank.
We have a new program that is called DAMUSASA that actually is being piloted through the ICT department. And that is a software that is being advocated to be used in hospitals so that you can link each area that has blood to that software. And that can also be networked with other facilities. So let's take, for example, Kenyatta National Hospital is networked with Nairobi Hospital, is networked with other private facilities. You can be able to see who has what kind of blood where. If someone has blood that is about to expire, you can actually share with the next facility. So we need systems that can be able to see each other so that through the national program, they can also be able to see who has more units, who may be sitting on blood that could help someone else elsewhere.
Okay. As we wind up, just based on what he's saying, do you think perhaps it is time for the Kenya National Blood Service to play more of an oversight role in terms of ensuring safety as opposed to being aggressive in terms of searching for the blood?
Okay.
As you give your closing comments.
So as we are now, we are a national service, and its service, we are not about to devolve the service. It's still a national service. Last year we collected about 150,000 units of blood. Our target was actually 180. The target was based on our resources, and what we are doing going forward is just to increase our activities, to go out more in a robust way, and to ensure that we get better partnerships. Yes.
But based on what he's saying, do you think it is more practical in terms of trying to build our blood bank?
Yeah, precisely. That's
we
the
need to
direction.
change, what the Kenya National Blood Transfusion Service
As
is
you
doing.
speak, let me just cut you short. Yeah, there is a legislation that is in place. We are developing the Kenya National Blood Management Bill.
Okay.
It is in the process, and some of the ideas that we're discussing here are integrated there. And we are welcome to any ideas from stakeholders to ensure that we re-engineer the way we do business to make it better so that we can make blood sufficient in our country.
All right. Thank you, Joseph.
Yes.
Gentlemen, thank you very much for coming to our studios today and, of course, sharing with us some of these insights. That is Joseph Kamotho, who is the blood donor recruiter at the Kenya National Blood Transfusion Service. We were also talking to Dr. Kibet Shikuku, who is a hematologist at the Kenyatta National Hospital, a lecturer at the University of Nairobi, and he also sits at the Kenyatta National Hospital Transfusion Committee. You've heard it. We're only getting 30% of blood, and we need more donors. So perhaps tomorrow you can find some time and go and donate some blood. We really need to build our blood bank as a country. This is where we end Your Health. Business News is up next, so stay tuned.